While most of us only know about monkeypox because of the 2022 outbreak, it was first discovered in humans all the way back in 1970. Now, if that statement just surprised you, stick around until the end to find out what if you get monkeypox. Numerous symptoms and indicators are associated with monkeypox. While some people experience mild symptoms, in some cases the disease may be severe and require medical attention. People at a higher risk for this disease include pregnant women, children, and people with impaired immune system. Now, the most frequent signs and symptoms of monkeypox during the 2022 outbreak were fever, headache, muscle aches, back pain, and swollen lymph nodes. Skin rashes can also develop for 2 to 3 weeks in several parts of the body. This includes the face, palms of the hands, soles of the feet, groins, and genitals. Apart from this, it might be discovered on the eyes, in the mouth, throat, vagina, or anus. Anywhere from 1 to several thousand sores may develop gradually. These skin sores start out flat and eventually fill with liquid, crust over, dry up, and fall off, revealing a layer of skin underneath. Studies are still being conducted to monitor and better understand the symptoms of the recent outbreak, including which body regions may be affected and how long the symptoms might remain. Anyone who may have monkeypox symptoms or has come into contact with someone who has should see a healthcare professional for guidance. Usually, the symptoms disappear on their own or with supportive treatment such as painkillers or fever reducers. But until all of the wounds have crusted over, the patches have peeled off, and a fresh layer of skin has developed underneath, a person is still contagious. So, how fatal is the disease? Well, monkeypox typically disappears on its own in a few weeks. However, it can sometimes result in serious issues or even death. The disease can also lead to further skin infections, pneumonia, disorientation, and vision issues. Proctitis and trouble urinating have also become more recent consequences. In the past, between 1 and 10% of monkeypox victims have perished. Now let's figure out how the disease is transferred from one person to another. Coming into close contact with someone who has the rash of monkeypox allows the disease to transfer from one person to another. The disease can also transfer through the air for unknown reasons, and more scientific research is being carried out to find out about this. We still don't know exactly how long monkeypox patients are contagious. All we do know is that they are infectious until all of the sores on the body have healed. The virus can also contaminate environments, such as when an infected person touches an item such as clothes or any object. If the person touching the object has any cuts, abrasions, or accidentally contacts their eyes, nose, or any other body part, they risk contracting an infection. This kind of transmission can be avoided by washing your hands right away after handling anything that might be infected. Experts are still trying to determine whether this mechanism of transmission is a significant factor in the ongoing pandemic. The virus can also transfer from a monkeypox patient to an infant or child during or after birth, through skin-to-skin contact, or during pregnancy to the fetus. Another popular question is, can you catch the disease multiple times? While it is still unclear if having had monkeypox in the past confers protection against subsequent infections, and if so, for how long. But some instances of secondary infections have been documented as well. So even if you've previously had monkeypox, you should take every precaution to prevent reinfection. And that is all for today's episode of Sound Health Solution. I hope you found the video informative. If you did, go ahead and hit that like button, and also subscribe if you haven't already. Also tell us your experience in the comments section if you've conquered this virus or if you know someone who did. As always, stay healthy, and I will see you in the next one.